Epilepsy is someone whose brain is able to make seizures repeatedly over time without anything else causing those seizures. It can come in a whole range of varieties. Some people are born with epilepsy. Some people have epilepsy develop later in life through causes that are known, such as a traumatic brain injury, or causes that we can't discover. So the type of seizure someone might have depends entirely on the kind of epilepsy they have. The two basic categories are what we call generalized, which kind of means whole brain seizures, or focal seizures, which means they start in one particular spot in the brain. With people who have generalized seizures, that can come out in a variety of ways. Sometimes the entire body will begin to shake all at once. Sometimes people will simply stop and pause, look like they're spaced out for a few seconds. There's a whole variety of types of shaking people can do as well. The other kind of seizures, focal seizures, really depend entirely on where in the brain the seizure starts. It can be in a very small area that might affect vision or might affect speech. It can be in a motor area that might affect one hand or one side of the body. So there's as many types of seizures as there are parts of the brain, which is quite a few.
My daughter Charlotte was diagnosed at 2 months old in July of 2012 with idiopathic epilepsy, and she has 3 different types of seizures. We went through a lot of EEGs, MRIs, just your basic seizure testing. So at that point, they pretty much diagnosed her with epilepsy because they said, you know, it's idiopathic, we're not sure why, but this is what's going on. They could never really tell us as to why she was having the seizures. We began seeing Dr. Turner at MUSC, and he really pushed for genetic testing to be done. So a couple months later, we were able to get genetic testing done, and it showed that she actually has a chromosomal deletion, which causes a lot of difficulties in children, along with epilepsy being kind of a secondary issue. We are administering emergency meds as needed. She hasn't had a seizure since September 2nd, so this is our longest spell without one, so it's very exciting.
Well, my son Eric was diagnosed 1 month before his 19th birthday, and he suffered from 3 grand mal seizures in 18 hours, which is not very common. Unfortunately, he was diagnosed very quickly after all of the tests. However, all the testing initially came out normal, which would make you think that he did not have epilepsy, but it was just the timing of the EEGs. You're not always able to catch it on the actual tests. So very quickly we learned that Eric was not responding to medication, and so he wanted to see if he was eligible for surgery. So after that testing, unfortunately we found out that he was not eligible for surgery due to the fact that the seizures were coming from both sides of the brain. But fortunately, the Epilepsy Center here at MUSC told us about a clinical trial called NeuroPace, and we found out that Eric was eligible for that. So a year later, Eric had surgery, and they implanted a computer into his skull and then 2 electrodes that go into the brain, and it actually detects his seizures and sends electrical impulses to stop the seizures before they become prominent. And so he is now grand mal seizure free. He still suffers from complex partial seizures, but we've come a long way from having 30, 35 seizures a month.
Look at my finger, go right to it. Perfect.
The first seizure I had was when I was a freshman in college, and I fell out of my loft while I was sound asleep. We'll never know if I had a seizure that caused me to fall or if I fell and hit my head and had a seizure. I went several years after that without any seizures, and then I had one day when I was at the gym. When the doctors in the ER called my parents that night, they told them they thought I had epilepsy. But I never heard that diagnosis using that word for several years. While I was pregnant and I was having more trouble with the seizures, I did some more research and discovered that there was a specialist known as an epileptologist, and I pursued finding one, and I was lucky enough to do so and find one that was able to work with me as far as doing all the testing and whatnot, that ultimately led to knowing I was a surgical candidate. And upon having surgery, I have been seizure-free for almost 5 years.
Living here in Charleston, there was not a lot of support available for epilepsy patients or their family members or caregivers. And unfortunately, the Epilepsy Foundation affiliate had actually closed its doors in 2009. So with a little bit of inspiration and just the desire to make a difference for the patients here in South Carolina, we started the South Carolina Advocates for Epilepsy, and we became a charitable organization in 2011, and we were recognized as a nonprofit on October the 25th of 2012. We want to help educate patients, families, even police departments, fire departments, anybody that we can reach out to, daycares, schools. We will come in and we will teach about seizure first aid and the difference between seizures and epilepsy.
I was introduced to Karen, who is the founder of SAFE, shortly after I had had surgery, and she was on a mission to spread the word about epilepsy and support people who were dealing with the new diagnosis. And I was definitely interested in getting on board with that because so many people don't understand what epilepsy is. Unfortunately, there's a stigma associated with it that is not even an accurate one.
One of the biggest myths about epilepsy is that the person actually has a form of possession or that it is contagious. And that is not true at all. And it's one of the biggest parts of the stigma that we try to fight all the time. Another myth is that you put something in a patient's mouth or a person who is having a seizure, such as a spoon or a wallet, and you do not want to do that.
One of the scariest things to see is a convulsive seizure. It often leads to someone falling down. They may have injuries from that fall. And frankly, it looks kind of scary, especially if you're not used to seeing that. It can also sound kind of scary. Try to remember the 4 C's. Stay calm, clear the area, comfort the patient as they're waking up from their seizure, and call 911, particularly if they've been injured. People actually do not swallow their tongue. That's a myth that's been around a long time. When someone has a seizure, the whole body locks up. All the muscles are tightening. That includes the diaphragm, which is the breathing muscle, and also the muscles of the throat. So that gives the appearance that someone's choking. But actually, as the seizure subsides and all those muscles relax, they'll often start breathing again. The most dangerous part about a seizure is where a seizure happens, the location or the environment. Most seizures will cause the person having the seizure to lose awareness of their surroundings. This may only be for a few moments. Many seizures are very subtle, may not cause even any shaking that someone else might observe and know it's a seizure happening. But it can be even 3 or 4 seconds of loss of awareness can be extremely dangerous depending on the exact situation. So that's why driving is such a top concern for people who have seizures and epilepsy. And we spend a lot of time talking with patients and trying to make sure that if they're safe to drive, they are, but if they're not safe, that they're aware of that. Really any circumstance such as fire, like you could get burned, heights you could fall off of, water in which you could drown, those are the things to be aware of, to avoid or make them safe.
It's a never-ending battle. You have got to be your child's advocate. Nobody knows your child like you. If a doctor tells you that something can't be done, don't accept that. Keep fighting. I've done it for Charlotte, and I wouldn't change a thing because of my perseverance and making sure that she gets the care that she needs. We were finally able to get a diagnosis of why she has epilepsy.
Most people with epilepsy actually, other than having occasional seizures, live completely normal lives. The main reason you don't know that they have epilepsy is they haven't told you. In other ways, you interact with them and they're just like everyone else.
Whenever I hear that someone has newly diagnosed seizures in particular, I want to give them a hug because it's a tough diagnosis to deal with. No one wants to hear the word epilepsy, but when you find the right treatment and whatnot, it's something you can get through.